Oh, hi, I'm Gary Dobbs. Have you been hair clubbed? Have you tried every potion, lotion, pill that's out there? Been there, done that. Maybe it's time for a transition.
Hair loss usually starts when a man, or a woman for that matter, is 19 years old. That is when the hormones, they kick in. What happens is you have a hair, it's growing normally, and it's replaced by a smaller hair. A hair that's been affected by DHT, or dihydrotestosterone. It's testosterone that dehydrates and then it infects the hair on top of your head and causes those hairs to get smaller and smaller and smaller until they disappear. There is nothing more heartbreaking than hair loss. When it comes to male pattern hair loss, the crown is more of a hormonal hair loss and the front hairline is more genetic. So the front hairline, whether you have a receding front hairline or a regular front hairline, is something that you've inherited in your family. Scalp Med and Rogaine, it's all minoxidil. You can go get minoxidil at the store for $30. You can go get finasteride from the drugstore for $20, $30. That's all they really are. They just simply slapped a label on it and they're selling it for $200, $300. Rogaine basically slows down the hair loss in the crown. It doesn't really grow hair. And the same thing with Propecia. If Rogaine and Propecia worked, then there would be no hair transplants. They're basically treatments. They're not a cure. People who get hair transplants, they're fed up. They've tried this lotion, they've tried this pill, they've tried everything, and it's not working. Everything that you need for really getting your hair back is right here in Huntsville, in the Tennessee Valley. We're a full-service hair replacement treatment center. And what that means is when some sort of hair loss treatment becomes viable, when some sort of hair loss treatment becomes doable, then we take that under our wing. Right now we know of 3 solutions to hair loss: the ultimate hair transplant, contact hair, and laser hair growth therapy. And those are available to you right here in the city of Huntsville, in the Tennessee Valley. A hair transplant is only as good as the doctor who's doing it. There is no name, there is no brand that's going to make that hair transplant great. The hair loss change that you see on television, that if you want to do a consultation, first of all, you probably either have to go to Nashville or you have to go to Birmingham. And then if you decide you want to do the grafts with them, then you have to go to Atlanta. A lot of people fall into the trap of, well, I'm just going to need one good session of hair transplants. And chances are you're going to need more than just one good session. They plant nothing but single hairs into slits. They plant a lot of them. But the problem is when you plant just single hairs from front to back and you're putting them into little cuts, you just have this thin cast of hair all over the top of your head. They're not taking out any bald tissue. What you have to do is you have to remove the bald. And you've got to replace that with growing hair. And then you can plant single hairs around that hair. Now if you go to your local dermatologist, and he'll probably just do 4 hair plugs. These will thicken the hair, but they look kind of pluggy. I've been doing hair transplants for 30 years. And Dr. Patterson has been doing every type of surgical procedure for 50 years. And what we came to develop is what we call the ultimate hair transplant. Using every kind of graft that you can possibly use. Not just 1 hair grafts, but 3 hair grafts, 4 hair grafts, and 1 hair graft and 2 hair grafts, and using everything in combination until you get a complete head of hair. When a consultation comes to the clinic, the first thing I look at is how thick their hair is in back. And then we take a look at the area, and then we determine just exactly where they want the front hairline to be. If you have thick enough hair in the back and you have thick enough hair around the sides and the hair loss area is not too huge, then you can take that hair from the back and you can plant that hair first in threes and fours, and then 2 hair grafts and then single hairs. You can take that hair and plant that hair on top, and that hair will grow for the rest of your life, and it will not fall out.
The hair on the back of the head is a different genetic makeup, and it's not under the influence of the DHT. Can you treat the grafts like any other hair? Yes, you can.
The ultimate hair transplant has to be done in stages. But once you get to the final stage, it's your own growing hair.
It can be styled, it can be colored. It's a true graft. It stays in place, it grows, and it's a living part of your scalp.
I first started noticing losing my hair back when I was probably around 30, 33 years old. I never tried any aftermarket or over-the-counter systems because I heard they never really worked. And then I learned about the Steve Latham method of the ultimate hair transplant and decided to give it a shot. When I came in to interview with Steve Latham, they were very warm and open and welcoming. There wasn't any uncomfortable feelings talking about losing my hair. Doc Pattison is a very skilled physician, and he talked to me about hair graft procedure.
Number one, time is devoted to getting the patient ready for the procedure, such as shampooing and trimming the portion of the donor site that the proper length so we can orient the hair correctly. Getting the patient set up for the procedure, getting the anesthetic. I would say that hair transplant procedure is 100% anesthetic, less threatening than going to the dental office. We want the patient to be comfortable, so we do, as far as the anesthetic, we use local anesthetic, which is probably the safest anesthetic that you can do.
I came in not knowing what to expect, so I was kind of hesitant, expecting maybe a lot of discomfort. But once the grafts and everything started going in, it wasn't bad at all. There wasn't hardly any discomfort or pain at all.
The second element is the surgical element, obtaining the graft material. We remove a small portion of the scalp, the back of the head where it doesn't show, where there's an abundant supply of hairs.
The incision site will be closed in a very systematic manner using a hidden stitch. It's called a trichophytic closure, where there's the edges of the incision are trimmed to minimize scarring and to make a better closure. And we're now using subcutaneous sutures, which bring the skin edges closer together before using the external running stitch for the final closure, with a much better result.
The next step, once the donor site is removed, it is processed by a technician who is well trained in separating the individual hairs for proper placement. At the same time, the technician is processing the hair follicles. The receptor area is prepared with anesthetic, and also small holes are prepared in the area of the scalp where the grafts are to be placed. We make sure that the orientation of the hair is going in the right direction, make sure it's going in the proper location. Dressing the incision, there's no dressing required, and as far as the grafts themselves, they stay in without a bandage as a rule. And this makes for a very good result.
Hair transplant technology has come a long ways. If you have been contemplating hair transplant. There's no better time than now. The technology has improved, it's affordable. Come see Steve at Steve Latham's Hair Transplant Clinic.
Well, after the procedure was done, we went ahead and went to lunch and then went back to the house and just relaxed and watched some television. I was able to get back to work within a day or two. I think I was showing signs of hair growth within 3 weeks. It's exceeded my expectations. My hair is growing excellent. It's coming in thick. I get a lot of compliments. A lot of my coworkers are noticing that I have a lot more hair. I'm real confident with the choice I made, that Steve Latham and the Ultimate Hair Transplant system works, and I'm really impressed with it. How do I feel about another procedure? Well, I'm looking forward to it. I want to see the end results of the Ultimate Hair Transplant, seeing, more hair with new grafts and seeing how it comes out.
Oh, hi, Gary here again. Well, you just watched the procedure there from Steve Latham of the Ultimate Hair Transplant. But that doesn't work for just everybody. For example, me.